Good morning. Good morning, everyone. Can you hear me this way? Okay. I do have a bit of coat. It's a great pleasure to be here and to bring you readings from the College of Health Science, Houston Community College, and the Department of Human Services. I want to talk just briefly about the historical development of community health workers in Texas. It really began through the impetus of the women, primarily at El Paso Community College, but parallel to them was work being done in the Valley, and a special group very close to me was an Acres Home group in Houston. So this really is a grassroots movement. In 1999, through some leadership of Dr. Darrell Williams, the efforts of these women were brought before the Texas legislature, and legislation authorized a group of 15 people to undertake the following tasks. And there's a very good article noted on there on the slide by Don Nichols, who was one of the originators from the state perspective. Then out of that group of 15, they developed a community health worker committee with this following representation. The original tasks of the committee were to review all applicants and bring forth health issues. That role has been pretty much diminished to an advisory committee based on what the Texas Department of Human Services CHW program bring forth. The distribution of community health worker certification, teacher certification sites now are 27. We'll see that 3 are at the community college level, 12 are agencies that offer 160-hour program, 6 are agencies that offer only CEUs, and there are 6 new emerging departments within 4-year and graduate schools, but they only offer either some CEUs or some 160 hours. There is no, these are only certificate courses. And so that's the distribution program. This is where those programs are located. You'll notice if you know anything about Texas, that they're primarily in the large cities, Guam, which is up in the Panhandle, El Paso, down around the border between Mexico and Texas. A number of them, of course, in Houston, Austin, Travis County, Waco, and Dallas-Fort Worth. And then this is the distribution of where the CHWs are located. There are 254 counties in the state of Texas, and the distribution is right at the 33% of the counties. So we've got a lot of work to do because the health needs in Texas are indeed growing. Now, I want to talk a little bit about the community college, the CHW program at Houston Community College. I have been teaching on both sides of the community college system, non-credit and credit, for about 7 or 8 years. Prior to that, I was teaching out in the community. And this is what the curriculum looks like. And let me take just a moment to explain how this works. Because community colleges are under the aegis of the Texas Board of Higher Education, they developed, Texas Board of Higher Education developed this WICM, which stands for Workforce Employment Course Manual. And it covers everything from healthcare to welders to plumbers, you name it. And the CH in all of these units stands for community health. And so what we did at Houston Community College, both on the academic and the continuing education side, was sit down and very carefully, with a lot of input, see where the designated by legislation 8 core competencies would go. And so this is the pairing in which they wound up being equally distributed. This is the first semester, this is the second semester, and then there is the third semester in which, according to WICM, you must have, or you can have, a field practicum. It is not, as Mary was mentioning, inside of the curriculum. It's just an entirely different course that you can take either after you finished your immediate work, or you can take it later on. And now what we're learning from the students is that there is a need for some students to go through the program in 1 semester. You can do that if you're not doing anything else, because it is very intense, and I'll show you in a minute how the curriculum operates. So most of our students are staying within the 3 semester delivery system. These are two faculty members, myself and my fellow teacher, Marion Scott. I just want to say a word about Marion. She had the first FQHC in Houston, and it was for the homeless. And we each are board certified by the DSHS as community health worker instructors. And that's something else that's rather unusual, I think. The DSHS has to certify every CHW instructor. Now, the educational format for the program is based, first of all, on grassroots testing. We are constantly in touch with members of communities, members of agencies, so that we can develop a student-centered set of student-centered learner objectives for each of the 8 core competencies. And someone asked me one time, where do you get these student-centered? And as I say, we develop them from community input that's constantly ongoing. Also, I'm very influenced by the work of Pablo Ferrara, who said that everyone knows something. And this has really stuck with the students. Once they realize they know something, they get out there through their service learning projects, they realize that other people know something as well. So building from the student-centered learning objectives, it is a hybrid course, and the reason we've done that is because Houston is 90 miles square, and transportation and time are a huge influence for these students to get class. Also, it gives them an opportunity through the distance education portion of the course to provide their own insights and experiences. And the service learning is very, very large part of it. We have a number of affiliations with agencies, and they actually go out and work within the agency, providing their services and making a lot of very important contacts. They come back saying that nobody seems to know what a community health worker is. And then putting their work together so that they can go out and market themselves. They also do a lot of resource identification. We gave them eye touches and flip cams. They came back with wonderful stories from people that they had discussions with. And then the final class presentation asks them to bring all of their experiences together. The levels of education, I wasn't quite sure what this meant and how to report this from Texas, but I use a lot of Bloom's taxonomy, if you know what that is, and also we do have Wickham student learning outcomes that are guidelines for the educational part. Also, we have the practicum agreements, and we're continuing to develop those. I'm very pleased to say we're going to have an agreement with a large system, a hospital system in Houston. We're going to place our first, there now, practicum students there, and they're going to be working with nurse navigators. This is the outcomes that we expect, the credit. MSA is a Marketable Skills Award, so when these community health workers finish, they will have not only the CHW deciding they'll have whatever marketable skill area they're working in. Employment as a CHW, an associate degree, and most of all, a higher level of health literacy. And I really appreciate the time, the effort that you all have put into this and to include me. Thank you very much.